Two areas in Bengaluru, ward number 134 and 135 have been completely sealed. BBMP Commissioner Anil Kumar has announced the clampdown to contain the spread of novel coronavirus, which seems to be spreading at a fast pace. Remember, Karnataka already has registered 197 positive cases. Padarayanapura ward and Bapuji Nagar ward sealed for 14 days. 5 positive COVID-19 cases were reported from these two areas. Anil Kumar said that the BBMP will supply essential items to the residents at their doorsteps. The BBMP Commissioner has further added that nobody will be allowed to enter or exit these two areas except for medical emergencies. My colleague Adarsh spoke to the BBMP Commissioner. Let's take a listen.
Well, with Padarayanapura completely off bounds, it has been sealed completely at this point in time, so there's no entry or exit whatsoever. We're right now at the Bapuji Nagar police station, where the BBMP commissioner himself has come down, along with several other BBMP officials and health department officials. Also, the cops are here. They're trying to discuss and ensure as to what's really happening in Padarayanapura does not go out of hands. So we have, in fact, the BBMP commissioner himself who's going to give us a word as to what really is transpiring in Padarayanapura. Sir, I'd like to know from you as to what's the ground situation in Padarayanapura and why is it worrisome? Why is it being locked down in the manner in which it is being done?
See, we have found 5 cases of positive COVID-19 in a very small area. So the essential reason for the clampdown is that we need to ensure that this is confined to this area and it doesn't spread out. So that is the reason why we want to clamp down. And second reason is that this area is a highly congested area with very narrow roads and streets. It's almost slum-like conditions. So we would not want that the spread of the virus, is there, and there should not be any kind of a outbreak here. So that is the reason why we are clamping down. As soon as we got the news that there are 5 cases coming within these 2 wards of BBMP, we have clamped down here, and we want to make sure that the entire area is contained and there is no spread of the virus to other areas and other people in this area. And most of the houses here are located very close to each other, and that is why we don't want this outbreak to happen here, and that is the reason why we want to ensure that it is totally contained.
At this point in time, it almost seems as though conducting a detailed survey in, say, Padarayanapura, which is going into a complete lockdown, is the need of the hour. While you were just mentioning about how clustered it is, the kind of slums that are really there, how close they are to each other, how easy will this survey be to carry out? And also, we've seen ASHA workers getting attacked across the state. So with attacks like that taking place, how well equipped are the authorities to really go ahead and carry out a survey in, say, Padarayanapura?
See, we have now formed about 60 teams who are going to go around and do the survey work, which with each of the team we will be having the police also in that. And more importantly, what we have been telling and we have been announcing here is that this is something which is being done for the benefit of the people here, and it is nothing connected with NRC as has been portrayed in other social media and media circles. So we would like to assure the people here that this is only for their well-being and to ensure that the spread of the virus is contained. And we have spoken to the community leaders. We have requested for their cooperation, which they have promised. And one cannot fight this virus on our own. It is not only the responsibility of the BBMP or the police or the government. Unless and until the people cooperate and come forward and cooperate with the authorities, it would be difficult to enforce anything, because this is not a law and order situation. It is a health emergency where we need to take care of everybody's sentiments. We need to take them along with us. We need to ensure that we all work together to prevent this kind of a spread of the outbreak.
Right. Now again, it almost on another note, if I were to say, wherever you go, it almost seems as though social distancing does not follow you. Even here, we've seen so many people standing here, all look like healthcare workers. Social distancing is again becoming a major issue. It is not being maintained across cities, and also the people also somewhere need to be more responsible. So, what is your larger message, both looking at the scenario right here and in general as well?
No, what I would like to emphasize is that social distancing is not the norm because everybody wants to get there first. And as a result, what we have seen is that even the media doesn't follow the social distancing norm. So we would request that everybody should follow the social distancing norm, and that is the way in which we can break the chain. We have, you can see at least BBMP teams are following some amount of social distancing, but the others are not. So I would request all people concerned, both media, public, everybody, to ensure that social distancing is maintained.
Many thanks. Many thanks. So that was the BBMP Commissioner himself, Anil Kumar, speaking about what really is transpiring in Padarayanapura, and additionally as to how social distancing is really the need of the hour, though it remains to be practiced by people. It is, in a sense, the responsibility of each and every citizen to go ahead and practice social distancing. But yes, again, when we talk about Padarayanapura, it is again a hot spot. It has been identified by the authorities. It will go into a full lockdown. It is going to be restricted, no movement in and out, and there will be a survey carried out by the authorities to really ascertain as to what really is going on. And this particular hotspot that has been identified and has been restricted, it is done so that the spread of COVID-19 does not take place any further. So it remains to be seen as to how this survey will be carried out and what kind of issues the authorities might face going forward. With cameraman Sushil, this is Adarsh for News 9.
We have some big news coming in. BBMP conducts health survey after sealing the areas. Asha workers conduct surveys in ward number 134 and 135. BBMP has formed several teams to conduct the survey. Let's go across to my colleague Adarsh, who joins us live from the spot with more information on the same. Well, Adarsh, do tell us what's the situation after the BBMP clampdown ward number 135 in Padarayanapura. Since you are at the spot, how are people responding to the clampdown order?
Well, Neha, in fact, at this point in time, we are outside the JJ Nagar police station where an important meeting has just concluded between the BBMP health officials, the cops, and also the authorities on the ground. So they're basically looking at two wards, the Bapuji Nagar ward and Padarayanapura, where the number of positive cases have only skyrocketed in the last few days. So in order to go ahead and somehow contain the spread of COVID-19, the health authorities on the ground are doing all they can. At this point in time, in fact, if we could just pan the camera and show a few visuals. We have the last few nurses, in fact, healthcare workers leaving the spot. But up until just a moment ago, this entire area was filled with healthcare workers who were sent to both the areas, Padarayanapura and Bapuji Nagar. So it's basically a survey of sorts that was conducted in these two areas. In fact, that is being conducted at this point in time. Let us go ahead and speak to one of the health officers who is in fact heading this very program as to what kind of a survey this is and how important it is going forward. So in fact, I have with us Balasundar, who happens to be a health officer. Mr. Balasundar, if you could tell us as to what this survey is about, how important is it, and also how many people are employed for this particular survey?
Three people from old Guddadal area, that's in Ward 135 of BBMP, had been to Delhi for some mass prayer, and they returned on 24th and they were at home. On 31st, on hearing media news and all that, whoever had been to Delhi, they were supposed to report to the hospital for examination voluntarily. They went to Victoria Hospital, they got themselves checked, and later they were quarantined at our government quarantine center. Then the result came as positive on 6th. So all the three are positive, and we have hospitalized them and they are on treatment. So once the patient, a person who has come from Delhi becomes positive, we have certain protocols given by Government of India and Government of Karnataka. So we are supposed to do a containment plan wherein we are supposed to identify primary contacts, secondary contacts of these persons. So we have identified all primary contacts and we have shifted them to our government quarantine and hospital setups. And the secondary contacts, we have to check whether they have any symptoms of any this COVID-19 disease. And also we are supposed to do, as per guidelines of WHO, that we are supposed to check the entire area around 3 kilometers surrounding area for fever survey, wherein we check for each households, each persons by certain prepared annexures wherein questionnaires are there. We'll ask them whether they have fever, cold, cough, sore throat, like that. Certain questions will be asked to the each individual households, and we fill it. And anybody has any symptoms of COVID, then they will be taken to our fever clinics. They will be tested there, and later the procedure as per the guidelines will take. This is what this survey is very much important, because this kind of area where this Padarayanapura, this Arafat Nagar, it's very densely populated, and most of them are below socio-economic. I mean, their socio-economic status is below low. So there, it's small houses are there. The overcrowding is there. So we need to check for any other cases in the area so that the disease doesn't spread. So we have sealed the whole area, like our Honorable Commissioner sir and all police people. We had a meeting in the morning. They have demarcated where all to be sealed, so that no person enters this area, this small area where the epicenter of that case is, the patient is there. No person enters here, no person goes outside. All essential services will be supplied to them through from BBMP side. Like vegetables and all, we are planning to have some push carts and send in the road so that people can buy them. We request all the public in this area not to come out of house. We are making continuous mic announcements also, and police are cooperating with us, so that if nobody comes, we check everybody, and if nobody, I mean, has any features of this, then the area will be safe, and we will wait for further instructions, because this quarantine period of the whole area will be for 14 days, and the decision will be taken by my higher-ups.
In fact, Doctor, if I were to ask you another question, this really sounds and seems like a large-scale exercise going forward, given the number of healthcare workers also that are present on the ground, that are going on the ground. So, given the fact that we've seen cases of, say, ASHA workers, healthcare workers being attacked, not just in Karnataka, but health officials being attacked across the country, what kind of measures are being taken on the ground to ensure that these healthcare workers, the frontline warriors who are going on the ground and crisscrossing each and every street, are safe?
See, we have 70 plus teams of survey teams, wherein a doctor, a staff nurse and other ASHA workers will be there in the teams. We have 70 teams, and we have seen in the media that some kind of this attack on ASHA workers has happened. So we have taken all precautionary measures. We have spoken, discussed with the police department. Now we have divided the team, and each team is being given with one constable. So the police will also come with the team. They will be there, and our team will work. I don't think there will be any problem for us, because we have taken all precautionary measures, and police are very cooperating with us.
Right. So one only hopes that there will be no problems for the healthcare workers, the frontline warriors who continue to be out there on the road doing service, human service for the common man. But again, if we were to talk about the future course of action, this survey is the first step, first of many steps it looks like. So what's the next course of action?
Presently, we do the survey, which is very important as per WHO guidelines, to find out any other cases are there and to know whether the disease is spreading or not. Once we do the survey and have a result, if no cases are there, no need to worry, no need to panic. Only we need to see for that quarantine period of 14 days. Otherwise, if we find any cases, I mean, if the cases are increasing the same epicenter, if the clusters are increasing, then there are cluster containment plans are there. We need to take different plans, wherein we need to take further strict actions, I mean, implement those measures to stop this spread of the disease. I don't think the situation has arisen. We have taken these steps because we are thinking it's a precautionary measure, and in advance only we are taking this action so that the disease should not spread, because we have only 3 cases, but these 3 cases may be a potentially dangerous thing, because the area is like that. They are densely populated, small roads, and people move around freely, and they are not listening to this lockdown, whatever 144 section. So we need some kind of strict vigilance on each and every household so that nobody comes out and nothing happens. Hope everything goes well.
There you have it. Hope that everything goes well. That's the final message from the health officer, Dr. Balasundar, who has been on the ground ensuring that all the teams that have been formed of healthcare workers are able to go onto the ground and ensure that they carry out their work without any hindrance going forward. The only request that the health officials and the BBMP authorities have is stay at home, and there is nothing to really worry about going forward.
Right. Thank you very much, Adarsh, for joining us with all of those details. Rather an informative, in fact, their discussion that you had. Well, now shifting our focus to Mr. Zamir Ahmed Khan, who also have spoken about the clampdown. Let's listen in.
ನಮ್ಮ ಎಲ್ಲ ದೇವಸ್ಥಾನ ಗುರುಗಳು ಮೀಟಿಂಗ್ ಒಂದು ಕರೆದಿದೆ, ಚರ್ಚ್ ಫಾದರ್ಸ್ಗಳು ಕರೆದಿದೆ, ಆಮೇಲೆ ಮಸೀದಿ ಗುರುಗಳಿಗೆಲ್ಲ ಕರೆಸಿ 1 ಅವರಲ್ಲಿ ಎಲ್ಲದಲ್ಲಿ ಅನೌನ್ಸ್ಮೆಂಟ್ ಮಾಡಿ ಅಂತ ಹೋದ ವಾರದಲ್ಲಿ ನಾನು ಮನವಿ ಮಾಡ್ಕೊಂಡಿದ್ದೆ. ಅದಲ್ಲಿ ಇವರು ಸಮೀವುಲ್ಲಾ ಇದ್ದಾರಲ್ಲ, ಸಮೀವುಲ್ಲಾ ಖಾನ್ ಏನು ಇವತ್ತು ಪಾಸಿಟಿವ್ ಬಂದಿದೆ, ಅವ್ರು ವಾಲಂಟ್ರಿ ಹೋಗಿ ಚೆಕ್ ಮಾಡ್ಕೊಂಡಿದ್ದಾರೆ. ಯಾರೂ ಅವ್ರು ಕರ್ಕೊಂಡು ಹೋಗಲಿಲ್ಲ, ಅವರೇ ಹೋಗಿ ವಾಲಂಟ್ರಿ ಹೋಗಿ ಚೆಕ್ ಮಾಡ್ಕೊಂಡು ಅವ್ರು ಪಾಸಿಟಿವ್ ಬಂದಿದೆ. ಈಗ BBMP ವತಿಯಿಂದ ಇದು ಲಾಕ್ಡೌನ್ 2 ವಾರ 135, 136 ಟೋಟಲಿ ಲಾಕ್ಡೌನ್ ಮಾಡಬೇಕಂತ ತೀರ್ಮಾನ ತೊಗೊಂಡಿದ್ದಾರೆ. ಅದಕ್ಕೆ ನಮ್ಮ ಬೆಂಬಲ ಇದೆ. ಮೊದಲೇ ಮಾಡಿ ಸರ್ ಅಂತ ನಾನು, ಕಾರ್ಪೊರೇಟರ್ ಅಲ್ತಾಫ್ ಖಾನ್ ಅವರು, ಆಮೇಲೆ ಕೇಶ್ ಅವರು 137 ವಾರ್ಡ್ ಅವರು ಹೇಳಿದ್ದಾರೆ, ದಯಮಾಡಿ ಲಾಕ್ಡೌನ್ ಮಾಡಿ ಸರ್ ಅಂತ ಹೇಳಿದ್ದೀವಿ. ಲಾಕ್ಡೌನ್ ಮಾಡ್ತಾ ಇದ್ದಾರೆ. ಅದ್ರ ಜೊತೆಯಲ್ಲಿ 6 ಜನ ಈಗ ಅವ್ರ ಮನೆಯಲ್ಲಿದ್ದ ಮನೆ ಕೆಳಗಡೆ ಮೇಲೆ ಇದ್ದವ್ರನ್ನ 6 ಜನ ಒಂದು ಹೋಟ್ಲಲ್ಲಿ ಎಲ್ಲೋ ಇಟ್ಟಿದ್ದಾರೆ. ಅವ್ರನ್ನ ಅಕ್ಕಪಕ್ಕ ಸರೌಂಡಿಂಗ್ ಒಂದು 7-8 ಮನೆಯಲ್ಲಿ ಒಂದು 20-25 ಜನ ಆಗ್ಬೋದು. ಅವ್ರನ್ನೂ ಕರ್ಕೊಂಡೋಗಿ ಯಾವುದನ್ನ ಏನಕ್ಕೆ ರಿಕ್ಸ್ ತೊಗೊಳಂಗಿಲ್ಲ, ನಾವು ರಿಕ್ಸ್ ತೊಗೊಳಕ್ಕೆ ಬೇಡದ ಅಂತ ಹೇಳ್ಬಿಟ್ಟು ಅವ್ರನ್ನೂ ಒಂದು ಹೋಟ್ಲಲ್ಲಿ ಶಿಫ್ಟ್ ಮಾಡೋದು ವ್ಯವಸ್ಥೆ ಮಾಡಿದ್ದೀವಿ. ಇವತ್ತಿಂದ 2 ವಾರ್ಡು ಲಾಕ್ಡೌನ್ ಮಾಡ್ತಾಯಿದ್ವಿ.
ಸರ್, ಕೇವಲ 3 ಜನನ ಸರ್ ನಿಜಾಮುದ್ದೀನ್ಗೆ ಹೋಗಿ ಬಂದವರು? ಕೇವಲ 3 ಜನ ಅಥವಾ ಬೇರೆ ಜನರು ಕೂಡ ಹೋಗಿ ಬಂದಿದ್ದಾರೆ ಸರ್ ನಿಜಾಮುದ್ದೀನ್ಗೆ? ಎಷ್ಟು ಜನ ಹೋಗಿ ಬಂದಿದೆ ಅಂತ ಸಂಖ್ಯೆ ಗೊತ್ತಾಗಿದೆ ಸರ್?
ಈಗ 3 ಜನ ಇಲ್ಲಿ ಬಂದಿರೋದು, ಬಂದಿರೋದು ಮಾಹಿತಿ ಪ್ರಕಾರ 3 ಜನ. ಭಾಳ ಜನ ಹೋಗಿ ಬಂದಿದ್ದಾರೆ, ಚೆಕ್ಕು ಮಾಡ್ಕೊಂಡಿದ್ದಾರೆ. ಚೆಕ್ ಮಾಡಿದಾದ್ಮೇಲೆ ಭಾಳ ಜನ ನೆಗೆಟಿವ್ ಬಂದಿದೆ. ಏನಕ್ಕೆ ಹಜ್ ಕ್ಯಾಂಪಲ್ಲಿ ಇಲ್ಲಿ ನಿಜಾಮುದ್ದೀನಿಂದ ಹೋಗಿ ಬಂದವರು ಜಾಸ್ತಿ ಜನ ಹೋಗಿ ನಮ್ಮ ಹಜ್ ಕಮಿಟಿ ಇದೆ ಅಲ್ಲೇ ಇದ್ದಿದ್ದು. ನಮ್ಮ ಹಜ್ ಕಮಿಟಿ ಹಜ್ ಭವನ್ ಅಂತ ಇದೆಯಲ್ಲ, ಅಲ್ಲಿದ್ದು 148 ಜನ ಬಂತು. 148 ಜನ ಅಲ್ಲಿ ಇವ್ರು 3 ಜನನೂ ಅಲ್ಲೇ ಇದ್ದಿದ್ದು, ಹಜ್ ಕಮಿಟಿದಲ್ಲೇ ಹಜ್ ಕ್ಯಾಂಪಲ್ಲೇ ಇದ್ದಿದ್ದು. ಆ 3 ಜನನೂ 3 ಜನಕ್ಕೆ ಪಾಸಿಟಿವಿಟಿ, ಮಿಕ್ಕಿದ್ದೆಲ್ಲ ನೆಗೆಟಿವ್ ಬಂದು ಅವ್ರವ್ರ ಮನೆಗೆ ಅವರು 2 ದಿನ ಹಿಂದೆನೇ ಅವ್ರ ಮನೆಗೆಲ್ಲ ಹೋಗಿದ್ದಾರೆ.
ಸರ್, ಈಗ 3 ಜನ ಪಾಸಿಟಿವ್ ಬಂದವ್ರ ಜೊತೆನೂ ಕೂಡ ಸಾಕಷ್ಟು ಜನ ಒಂದು ಸಂಪರ್ಕ ಹೊಂದಿರ್ತಾರೆ ಸರ್. ಈಗ ಅವರಲ್ಲೂ ಕೂಡ ಒಂದು ಆತಂಕ ಇದೆ, ಇದು ಎಲ್ಲಿ ನಮಗೂ ಕೂಡ ಅಂಟ್ಕೊಳ್ಳುತ್ತೆ ಅನ್ನೋದು.
ಖಂಡಿತ. ಈಗ ನನಗೂ ಒಂಚೂರು ನಾವೆಲ್ಲ ಏರಿಯಾ ರೌಂಡ್ಸ್ ಹೊಡಿತಾ ಇದ್ದೀವಿ. ಆ ಏರಿಯಾಗೆ 2-3 ಸತಿ ನಾನು ಹೋಗಿ ಬಂದಿದ್ದೀನಿ. ಆತಂಕ ಇದ್ದೇ ಇರ್ತದೆ. ಆ ಥರ ಏನಾದ್ರು ಸೆನ್ಸ್ ಬಂದರೆ ನಾವು ಹೋಗಿ ಚೆಕ್ ಮಾಡ್ಕೊಳ್ಳೋದು ಒಳ್ಳೆಯದು. ಅದಕ್ಕೆ ನಾನು ಹೇಳಿದೆ, ಟೋಟಲ್ 2 ವಾರ್ಡು ಲಾಕ್ಡೌನ್ ಮಾಡೋಕ್ಕೆ ತೀರ್ಮಾನ ತಗೊಂಡಿದ್ದಾರೆ. ಅದಕ್ಕೆ ನಮ್ಮ ಬೆಂಬಲ, ಕಾರ್ಪೊರೇಟರ್ದು ನಮ್ಮದೆಲ್ಲ ಬೆಂಬಲ ಇದೆ
ಸರ್. ಜನರು ಸಹಕರಿಸುವಂತಹ ಅವಶ್ಯಕತೆಗೆ ತುಂಬ ಇರುವಂಥದ್ದು. ಯಾಕಂದ್ರೆ ಸರ್, ಜನ ಮನೆಯಿಂದ ಆಚೆ ಬಂದರೆ ಇದು ಸೀಲ್ ಡೌನ್ ಮಾಡಿದ್ರು ಕೂಡ ಉಪಯೋಗ ಇಲ್ಲ ಅನ್ನೋದು ಕೂಡ ಒಂದು BBMP ಕಳಕಳಿ.
ಇಲ್ಲ, ಜನಗಳಿಗೆ ಈ ಮಾಧ್ಯಮ ಮುಖಾಂತರ ನೋಡಿ ಅವ್ರಿಗೂ ಒಂಚೂರು ಅವೇರ್ನೆಸ್ ಬಂದಿದೆ. ಹೀಗೆ ನೋಡ್ತಾ ಇರ್ಬೋದು, ಈಚೀಚೆಗೆ ಯಾವಾಗ ಇದು ಲಾಕ್ಡೌನ್ ಅಂತ ಪ್ರಧಾನಮಂತ್ರಿಗಳು ಅನೌನ್ಸ್ ಮಾಡಿದಾದ್ಮೇಲೆ 5-6 ದಿನ ನಮಗೆ ಸಾಕಾಯಿತು. ನಾವು ಅನೌನ್ಸ್ಮೆಂಟ್ ಮಾಡಿ ಎಲ್ಲ ನೋಡಿ, ಈಗ ಜನಗಳಿಗೆ ಎಲ್ಲೋ ಒಂದು ಕಡೆ ಇಲ್ಲ ಇದು ಮಾಡ್ತಾ ಇರೋದು ಸರಿ, ಇದು ನಾವು ತಪ್ಪು ಮಾಡ್ತಾ ಇದ್ವಿ ಅಂತ ಜನಗಳಿಗೆ ಅರಿವಾಗಿ ಈಗ ಸ್ವಲ್ಪ ಕಂಟ್ರೋಲ್ ಆಗಿದೆ. ಮುಂಚೆ ಹಂಗಿಲ್ಲ, ತಾವು ನೋಡ್ತಾ ಇರ್ಬೋದು, ಇಲ್ಲಿ ನಿಲ್ಲಕ್ಕಾಗ್ತಾ ಇರಲಿಲ್ಲ. ಒಂದಿನ ಒಂದು ಮೀಟಿಂಗ್ ಕರುವಾಗ ನೀವೇ ಮಾಧ್ಯಮದಲ್ಲಿ, ನೀವು TVನಲ್ಲೇ ನೋಡಿದ್ದೀನಿ ನಾನು, ಜನ ಜಾತ್ರೆ ಆಗಿಬಿಡ್ತು. ಇಲ್ಲ, ಏನು ಮಾಡೋಕ್ಕಾಗಿಲ್ಲ, ಈ ಏರಿಯಾನೇ ಆ ಥರ ಅದು. ಈಗ ಜನಗಳು ಎಲ್ಲೋ ಒಂದು ಕಡೆ ಅವೇರ್ನೆಸ್ ಬಂದಿದೆ, ಅದಕ್ಕೆ ಸಹಕರಿಸ್ತಾರಂತ ನನಗೆ ವಿಶ್ವಾಸ ಇದೆ.
ನಿಜಾಮುದ್ದೀನ್ ಹೋಗಿ ಬಂದು ಇನ್ನೂ ಸ್ವಲ್ಪ ಜನ ಇದ್ದಾರೆ, ಅವ್ರು ಯಾರು ಕೂಡ ಹೇಳ್ಕೊಳ್ದಲ್ಲ ನಾವು ನಿಜಾಮುದ್ದೀನ್ ಹೋಗಿ ಬಂದಿದ್ದೀವಿ ಅಂತೇಳಿ. ಸೊ ಅಂಥವ್ರ ಬಗ್ಗೆ ಮಾಹಿತಿ ಸಿಗ್ತಾ ಇದೆ.
ಎಲ್ಲರಿಗೂ ನಾನು ಆಲ್ರೆಡಿ ಮನವಿ ಮಾಡ್ಕೊಂಡಿದ್ದೀನಿ. ಇನ್ನೊಂದು ಬಾರಿ ನೀನು TV ಮುಖಾಂತರ ಮನವಿ ಮಾಡೋಕ್ಕೆ ಕೇಳ್ಕೊತೀನಿ, ದಯಮಾಡಿ ನಿಜಾಮುದ್ದೀನಲ್ಲಿ ಯಾರ್ಯಾರು ಹೋಗಿ ಬಂದಿದ್ದೀರಾ, ನಿಜಾಮುದ್ದೀನ್ ಅಂದರೆ ಮರ್ಕಸ್ ಮಾತ್ರ ಅಲ್ಲ, ಆ ಸರೌಂಡಿಂಗಲ್ಲಿ ನಿಜಾಮುದ್ದೀನ್ ಒಂದು ದರ್ಗಾ ಇದೆ, ಅಲ್ಲೂ ಹೋಗಿ ಬರ್ತಾರೆ ಭಾಳ ಜನ. ಆ ಕರೀಮ್ ಹೋಟ್ಲ್ ಅಂತ ಇದೆ ನಿಜಾಮುದ್ದೀನ್ ತವ, ದಿಲ್ಲಿಯಿಂದ ಎಲ್ಲ ಬೇರೆ ರಾಜ್ಯದಿಂದ ಎಲ್ಲೋದ್ರೂ ಅಲ್ಲಿ ದಿಲ್ಲಿಗೆ ಹೋದ್ರೆ ಏನು ಮಾಡ್ತಾರೆ, ಒಂದು ಕರೀಮ್ ಹೋಟ್ಲ್ ಅಂತ ಇದೆ, ಅದು ನಿಜಾಮುದ್ದೀನಲ್ಲಿ ಬರ್ತದೆ. ಅದು ಭಾಳ ಜನ ಟೇಸ್ಟಲ್ಲಿ ಹೋಗ್ತಾರೆ, ಬರೀ ಮುಸ್ಲಿಮ್ ಅಂತಲ್ಲ, ಎಲ್ಲ ಧರ್ಮದವರಲ್ಲಿ. ಏನಕ್ಕಂದರೆ ಅಷ್ಟು ಟೇಸ್ಟಿ ಊಟ ಅಲ್ಲಿ ಯಾರ್ಯಾರು ಹೋಗಿ ಬಂದಿದ್ದೀರಾ, ನಿಮ್ಮಲ್ಲಿ ಇನ್ನೊಂದು ಬಾರಿ TV9 ಮುಖಾಂತರ ಕೈ ಜೋಡಿಸಿ ಮನವಿ ಮಾಡಿ ಕೇಳ್ಕೊತೀನಿ, ದಯಮಾಡಿ ತಾವು ಯಾರ್ಯಾರು ಅಲ್ಲಿ ಹೋಗ್ಬಿಟ್ಟು ನಿಮ್ಗೇನು ಇದಾಗಲ್ಲ, ತೊಂದರೆ ಆಗಲ್ಲ, ದಯಮಾಡಿ ನೀವು ಹೋಗಿ ಚೆಕ್ ಮಾಡಿಕೊಂಡ್ರೆ ನಿಮಗೂ ಒಳ್ಳೆಯದು, ನಿಮ್ಮ ಕುಟುಂಬಕ್ಕೂ ಒಳ್ಳೆಯದು, ನಮಗೂ ಒಳ್ಳೆಯದು, ನಮ್ಮ ರಾಜ್ಯಕ್ಕೂ ಒಳ್ಳೆಯದು.